In the world of human anatomy, few subjects are surrounded by as much misinformation and social weight as the hymen. For generations, it has been viewed through a cultural lens rather than a biological one. Today, we are setting aside myths to look at the cold, hard science. Our goal is to provide clarity, accuracy, and a better understanding of female physiology. What is the hymen, truly? And does it actually function as a biological seal? Let's dive into the evidence. Biologically, the hymen is not a cover or a seal that completely blocks the vaginal opening. If it were, physiological functions like menstruation would be impossible. Instead, the hymen is a thin, flexible collar of tissue located about 1 to 2 centimeters inside the vaginal opening. It is a vestigial remnant of fetal development, essentially a leftover piece of tissue from when the reproductive system was forming in the womb. It has no proven biological function in adulthood. It doesn't protect organs or filter bacteria. It is simply there, varying significantly from one person to another. Diversity is the rule in anatomy. Hymens come in various shapes and sizes. The most common is the annular hymen, which is ring-shaped. Then there is the crescentic hymen, shaped like a half-moon. Some individuals have a septate hymen, where a thin band of tissue creates 2 small openings instead of 1, or a cribriform hymen, which features many tiny perforations. Crucially, some females are born with very little hymenal tissue, while others are born with an imperforate hymen, a rare medical condition where the tissue completely covers the opening, requiring a minor surgical procedure to allow menstrual flow. The key takeaway here is that normal has many faces, and the absence of visible tissue does not indicate a medical or physical history. It is often just a natural anatomical variation. The most persistent myth is that the hymen is a definitive proof of virginity. From a clinical perspective, this is incorrect. Because the tissue is flexible and thin, it can be stretched or thinned by many non-sexual factors: vigorous sports, horseback riding, gymnastics, or even routine medical exams. Furthermore, many hymens are compliant or elastic, meaning they can stretch without tearing at all. Therefore, a physician cannot determine a person's sexual history simply by looking at the hymen. Science confirms that virginity is a social and cultural concept, not a physical state that can be measured by a piece of tissue. During the first instance of intercourse, the hymen may stretch or develop small microtears. While some experience slight spotting or mild discomfort, others experience nothing at all due to the elasticity of their tissue. Medical professionals emphasize the importance of gradual comfort and lubrication to prevent trauma to the area. If significant pain occurs, it is often due to muscle tension or lack of preparation rather than the tissue itself. Understanding this helps reduce unnecessary anxiety and promotes a healthier approach to physical intimacy. Education is the best tool against stigma. By understanding the hymen as a biological variable rather than a moral indicator, we respect the reality of human science. We hope this breakdown has provided you with the clarity needed to separate fact from fiction. Thank you for watching this scientific inquiry into human anatomy. Stay informed and stay curious.